Our bodies have a system called the endocrine system. This system is crucial for regulating various functions in our body, from growth and metabolism to mood and reproductive processes. It's like a messaging system that uses hormones. These hormones are produced by glands and released into the bloodstream to reach different organs and tissues. Hormones are like chemical messengers. They carry instructions from one part of the body to another, ensuring that everything works in harmony. They travel in our blood to different parts of the body. This journey allows them to influence various bodily functions, such as heart rate, sleep cycles, and even our mood. Endocrine disorders happen when this messaging system has problems. These issues can arise from either the overproduction or underproduction of hormones. Sometimes the body doesn't make enough hormones. This deficiency can lead to conditions where the body cannot perform certain functions effectively. Other times it makes too many. Excessive hormone production can also disrupt normal bodily functions, leading to various health complications. This can cause various health issues. Symptoms can range from fatigue and weight changes to more severe complications like heart disease or infertility. In this essay, we'll discuss 3 common endocrine disorders. These are diabetes mellitus, hypothyroidism, and hyperthyroidism. Each of these conditions affects the body in unique ways and requires specific treatments. Understanding these disorders can help us take better care of our health. By recognizing the symptoms and seeking appropriate medical advice, we can manage these conditions effectively and improve our quality of life. Hormones play a crucial role in regulating many bodily functions. They control our growth, metabolism, and mood. Hormones also affect our sleep, heart rate, and reproduction. Insulin is one example of a hormone. It's made by the pancreas. Insulin helps our bodies use glucose or sugar from food for energy. When our bodies don't produce enough insulin or use it properly, it leads to diabetes mellitus. Diabetes. Mellitus is a chronic condition that affects millions of people worldwide. It is a serious health issue that requires ongoing medical attention and lifestyle changes. This condition affects how our bodies use glucose, which is a type of sugar that is a crucial source of energy for our cells. Glucose comes from the food we eat, and it is essential for our body's proper functioning. The foods we consume are broken down into glucose, which then enters our bloodstream. It's our body's primary source of energy, fueling everything we do, from simple movements to complex bodily functions. In diabetes, the body either doesn't make enough insulin, a hormone produced by the pancreas, or can't use it effectively. Insulin is vital because it helps glucose enter our cells. This leads to high blood sugar levels, also known as hyperglycemia. Persistent high blood sugar can cause various health complications. Over time, high blood sugar can damage our organs, including the heart, eyes, and kidneys. This damage can lead to serious health issues such as heart disease, vision problems, and kidney failure. Diabetes is a serious condition that requires careful management. Without proper treatment, it can lead to severe complications and impact the quality of life. But with proper management, including medication, a healthy diet, regular exercise, and regular monitoring of blood sugar levels, people with diabetes can live long and healthy lives. It's important to work closely with healthcare professionals to manage this condition effectively. There are 2 main types of diabetes, type 1 and type 2. Each type has distinct causes and symptoms that affect the body in different ways. Type 1 diabetes is an autoimmune disease. This means that the body's immune system, which normally protects against infections, mistakenly attacks its own cells. Specifically, it targets and destroys the insulin-producing beta cells in the pancreas. Without these cells, the body cannot produce insulin, a hormone essential for regulating blood sugar levels. Type 2 diabetes is more common and typically develops in adults, although it is increasingly seen in younger populations. Unlike type 1, it is not an autoimmune condition. In type 2 diabetes, the body either becomes resistant to insulin or doesn't produce enough insulin to maintain normal blood glucose levels. Insulin resistance means that the body's cells do not respond properly to insulin. This condition is often linked to lifestyle factors such as obesity, poor diet, and physical inactivity. Maintaining a healthy weight, eating a balanced diet, and regular exercise can help manage and even prevent type 2 diabetes. Common symptoms of diabetes include frequent urination, excessive thirst, unexplained weight loss, increased hunger, and fatigue. These symptoms occur because the body is unable to properly use and store glucose, leading to high blood sugar levels. Monitoring blood sugar levels regularly is crucial for managing diabetes. Early detection and proper management can prevent complications and improve quality of life for those living with the condition. Section 5. Managing diabetes, treatment and lifestyle changes. Managing diabetes involves keeping blood sugar levels within a healthy range. This typically involves a combination of medication, diet and exercise. People with type 1 diabetes need insulin injections or an insulin pump to manage their condition. Type 2 diabetes can often be managed with oral medications along with lifestyle changes. Lifestyle changes for managing diabetes include eating a balanced diet, exercising regularly, maintaining a healthy weight, and monitoring blood sugar levels. Section 6. The thyroid gland, hypothyroidism and hyperthyroidism. The thyroid gland is a small butterfly-shaped gland in the neck. It produces hormones that regulate metabolism. Hypothyroidism occurs when the thyroid gland doesn't produce enough thyroid hormone. Hyperthyroidism, on the other hand, is when the thyroid gland produces too much thyroid hormone. Both conditions can cause a range of symptoms and require medical attention. Section 7. Symptoms and treatment of thyroid disorders. Hypothyroidism slows down metabolism. This can lead to fatigue, weight gain, constipation, dry skin, and sensitivity to cold. Treatment usually involves taking synthetic thyroid hormone medication. Hyperthyroidism speeds up metabolism. This can cause weight loss, rapid heartbeat, anxiety, tremors, and heat intolerance. Treatment options include medications, radioactive iodine therapy, or surgery to remove part of the thyroid gland. Section 8. Seeking medical attention for endocrine disorders. Early diagnosis and management of endocrine disorders are crucial. If you experience any symptoms of diabetes, hypothyroidism, or hyperthyroidism, consult a healthcare professional. They can perform tests to diagnose the condition and recommend appropriate treatment options. Remember, managing endocrine disorders requires ongoing care and attention to maintain overall health and well-being.